each area you're doing light and then deep.
Yes.
Okay.
Now, like I said, if for example the patient says, I have pain on my left lower quadrant, you do that last. Okay. And if you, on percussion, you percuss that the spleen is enlarged, do not palpate anymore. Okay. So this is for the general palpation of the abdomen. And then we do by manual. Right?
Yep, liver border.
Liver border. Okay, so here, okay, like we said, 11th and 12th rib, just okay, push. You can see me pushing, okay, and then this is her costal margin, okay, slide deep. Okay, I can feel the liver border here. Okay.
It's like she gets a kick out of this.
Why do you feel the liver border?
It's normal.
Oh.
Okay, because you're very slim, so
Okay.
you can really feel it.
Okay.
It's smooth. Okay. Do you feel any pain?
A little bit, like pressure.
But not pain.
No,
pain.
no.
Okay. Another technique is like this. So, like I said, push and then curl your fingers under the costal border. But you have to move it this way. Okay, I prefer this technique. So glide it under.
Would you still feel it if we're a little heavy set?
Yeah,
You have
Shell,
to
am
go
I gonna
deeper.
feel it on you?
Deeper?
You really have to go deeper.
Okay.
Now, we palpate for the spleen. So, wait, what's this? Okay, so again, 11th and 12th ribs, push up. Okay, this time this is the border of the what they call this, the costal margin.
Ruby, you would be our person if we pick this.
Feel it. Okay, you are not going to feel the spleen, not at all. You're not going to feel it. Okay, then we move down, going by the flank. Just relax.
Okay.
Okay, and then I will push. Okay, so here, take a deep breath. Okay, hold. Palpate deep. Okay, I feel the upper pole of her left kidney. It's over on this side. Okay, relax. Okay, and then over on the right. Okay, push again. Okay, and then take a deep breath. Here I don't feel it. On the other side I do. Okay, so that is for the kidneys. Relax. All right. So that's, why is your face like that?
Because it looked like it hurt. I'm sorry.
No, it doesn't hurt.
So special maneuvers for
doesn't hurt.
ascites.
Okay, and then we have now our special tests. So the first one is for ascites. So it's just a matter of measuring the abdominal girth. The second one will be for the fluid wave. So you ask the patient, put your hand this way, okay, in the midline.
When you're
Okay,
measuring the abdominal girth, you go from.
you have to go all the way. Just
Oh,
measure
right,
the waist.
okay.
With a measuring tape.
Okay. Okay, so for the, all good?
Yep.
Okay, so for the fluid wave, you ask the patient to put the hand ulnar aspect in contact along the midline. Your other hand will be here, and then on this side, tap it. Okay, if there is ascites, you will feel the wave all the way here.
Who figured that out?
I was gonna say the same thing. I wonder who figured it out.
It's very interesting though.
Let's just slap it. See if we can see on the other side.
Tap it, and then you will feel the movement of the fluid transmitted all the way to this other hand. That's why you have this, because this will allow the fluid to be transmitted all the way here.
Wouldn't you still feel like I'm hitting myself now? I still feel myself. Like, are you? Is it like a really
Yeah, but are you
pronounced
putting
wave?
this-
You're not
It's
putting your
like-
hand
it's-
midline.
it's like-
Oh,
vibration.
Oh,
Yeah.
okay.
Wait, do you have ascites?
That's what I was like,
Ah.
I like feel myself hit.
No,
Like,
Learn
but
something
the,
every day.
the feeling that you'll have here will be like,
If you see a wave, you got a problem.
I mean, it jiggles. I don't know. If that's a
no,
wave.
That's not a wave.
but when you feel it, it's like there's movement here. Like
YouTube,
dribbles.
you'll find it.
Oh, okay.
There's movement here on your hand, over here.
Okay, well, that's why I asked. It's
That's
like,
right, that's right.
You know, like.
But if you think, oh, let me see, she has a very big abdomen, and then you tap, okay, even if you tap hard enough, you will not feel that movement here on your hand because it's not fluid. It's not going to be transmitted all
So it
the way.
should feel like water then, like a water balloon or something, right?
Like a water,
Yeah.
water.
That's what I was saying. I was like, if you hit yourself, you're still gonna feel it. Like,
No, but it's not, it doesn't feel like the as Gina said, the ripples, right? Okay, so this is for the fluid wave test. And then we have the shifting dullness. So here, we start with the percussion from the umbilicus. Okay. Tympanic all around. Okay, so we hear the change here. Okay, so initially it was tympanic, and then if the patient has fluid, you will hear the fluid on this side. Okay, so more of tympani here and then fluid. Now, if we ask the patient, can you please turn to the right? Okay, so this is what I was saying. The acidic fluid, it will be moving towards the dependent area. So over on this area,
If you're fat, it's gonna go down there too.
yes, but it's not going to be tympanic. There won't be any change in
okay.
the
Got it,
tone.
okay.
Okay, because when you're doing it initially as the patient is lying supine, the change in the change from tympanic to dullness will be marked on one spot. You ask the patient to turn to the right, it will be on the same spot. So
Oh, okay.
again, all the way. So it's over here where you will feel the change because she does not have ascites.
Yay.
Okay. So
Congratulations.
questions? Wait, not yet.
Shifting.
Shifting dullness.
She just
Okay.
really wants to get up.
Hold on, a few more. And then we have the tests for APP. Okay, so the first one will be the rebound or the Blumbergs. So we palpate here on the right, okay, gently, because the patient is, oh, you know, I have pain on the right lower quadrant, so you palpate gently, okay. But when you lift, that's when they feel the pain.
Rebound.
Okay, that's the rebound tenderness. Second is the Rob sinks. I will palpate here,
Should hurt on the other side.
okay. Where do you feel the pain?
Oh, I don't know.
On the right lower quadrant. Okay, and then you have now the psoas. Okay, can you please raise your leg? Raise your leg. Keep the knee straight. Okay.
Raise your
So
right leg.
I will ask you to resist. Okay. So as you try to push the thigh down, okay, again there will be pain here on the right lower quadrant. And then the last will be, okay, bend your knee. Relax, relax. You have to make sure that the foot is off the bed. Push it in and then out. Okay, and she will feel pain on the right lower quadrant. So basically, when you palpate the right lower quadrant, that's the first and last time you need to do it, because you're not going to touch that area anymore. Okay, then we
Alright.
do our
Acute cholecystitis,
Acute-
Murphy's sign.
okay, acute cholecystitis. So here, okay, this is her right costal margin. Okay, ask the patient, can you please take a deep breath? Okay, and then
Oh,
palpate deeply. Okay.
Is this the one where she goes?
So if she is in pain because of an inflamed gallbladder, relax. She will hold her breath. She goes that. But if she's she just is able to breathe, inhale and hold it, there is no problem. That is a negative Murphy's. Okay. And then the last will be for hepatic coma, so the asterexis. So we ask the patient, can you dorsiflex both hands at the same time for about 15 seconds. Okay, for about 15 seconds. Okay, so normally you don't see any movement. Now when it starts flapping, no matter how trivial the movement, that is still hepatic enceph. So that means the liver is failing, unable to eliminate the wastes. Even the kidneys are, slowly shutting down because
How did they
there's
figure
too
that
much
out?
waste. To,
But why does it make your...
Because the waste, especially ammonium, it's being deposited in the brain cells.
Okay.
That's why any movement
So
will
it's an
now-
early or a late sign of like liver?
Oh,
It's
it's
late
a-
already? If ammonia is up here, it's late
Yeah.
already, right? Yeah.
Even the, like I said, even the kidneys are slowly shutting down because there's too much that it cannot eliminate it. So it builds up, gets deposited in our in the brain cells. Okay, so this is for the abdomen. Questions?
No, no.